Okay.
Hello, everyone, and a very good evening, good morning to everybody who's here from different parts of the globe. We welcome you here today in yet another webinar under the By Design series by the Anant National University. This webinar, Water, Welfare, Health in Urban Settings, is especially a part of our series of building and designing healthy cities that we have started jointly with USAID and JSI. We have with us very eminent panel today to take up this topic and look at various aspects of how water and can affect the health in our urban settings. I would now want to ask Amanda Stevens to take charge of the event and be with you for the rest of the evening. Amanda is the project director for the Building Healthy Cities project and works with John Snow Inc. Over to you, and welcome everybody. Thank you.
Thank you, Ashima. We're so pleased to be able to partner with Anant National University on this webinar series. If you haven't been able to join us for the previous two webinars, the recordings are available both on the Anant U Facebook page and the JSI Building Healthy Cities webpage. So we encourage you to look back at those. We're very excited to be able to host this final webinar around water, welfare, and health. We're trying to think a little bit outside the box for this particular webinar because, as many of you know, water and health are intrinsically connected, but planning for them hasn't always been connected. So while our health is dependent on not just access to clean water and avoidance of polluted water, the planning and the funding of these activities is not always linked. Regarding health, polluted water can carry a number of diseases. It can be a breeding ground for mosquitoes. It can spread toxic pollutants into the homes and playgrounds and workplaces of citizens. Women and children are particularly vulnerable via greater risk of pregnancy and reproductive complications, higher mortality from waterborne disease, and increased physical labor to carry clean water to the household. In the face of climate change, we wanted to spur constructive discussion today about how cities, and in particular smart cities, can think about and plan for the full cycle of water in order to be more efficient with this increasingly scarce resource. And as Ashima mentioned, we have a very eminent panel to lead us through this talk today. I'll just quickly run through what we'll be hearing about, and then I'll introduce each speaker before their presentation. So we are very lucky to have Ms. Aditi Garg, the CEO of Smart City Indore Development Limited, or ISCDL, who will be kicking us off with a recap of what ISCDL is doing in Indore, and how some of those activities interact with water and how water might affect some of those plans. Kevin Nelson is then going to speak to us from USAID's perspective on their learning series, their knowledge brief series around water issues, including water and sanitation, and they have one in particular on urban water. We'll then hear from Dr. Suresh Rohilla, who's going to be sharing with us some pilot projects around the country in India that might be of interest. And then Dr. Anuradha Jain from USAID Mission will be closing us out with some exciting news around a new project that they're funding. So this is our program. We will have everyone on mute as participants, but please do type in your questions in the chat, because there will be a Q&A session at the end. And our panelists would love to answer your questions. So with that, I'm going to introduce our first speaker properly. We have just lost our slides, so I'm going to see if I can share with you. There we go. Okay. So as I mentioned, Ms. Aditi Garg is the CEO of ISCDL. She's currently in this position, and under her leadership, Indore has become India's first city to earn 5 million rupees through the carbon credits program. Ms. Garg has been involved in many awards for Indore during her tenure. We're pasting in her full bio into the chat because we want to save as much time as possible to let her tell us from her own, in her own words, about what ISCDL has been doing in Indore. Thank you for joining us, Ms. Garg, and I'm going to hand it over to you now.
Hi, Amanda, and hello to all the fellow panelists. I hope I'm audible. Right. Amanda, I was just wondering, I've shared a PPT, if that can be shared as well. So as I present, maybe I can present a few slides of the. Thank you, Amanda and the team, for such a kind presentation of my own bio. You've been more generous, I think, than required. At Indore Smart City, we've been looking at water and its concomitant issues through the lens of area-based development. We have undertaken what has been a mixed approach towards our understanding of how we deal and tackle with water issues. Indore is not perhaps one of those cities that has had the problem of either an extreme drought or water scarcity or flooding, but at the same time, we've had to deal with our own set of issues with regard to better water management, 100% distribution of clean water, and as well as linking our existing riverbeds. What I will take you through is a brief insight into some of the work that we have done. Amanda, if we can just go to the next slide. Smart City Indore has worked on an approach called the riverside to riverfront approach, where we have tried to do a combined development of our existing 7 interlinked rivers. The, the enormity of the work can be understood by the way in which we have tackled the problem of cleanliness. Indore started with trying to clean the riverbeds. We wanted to clean the riverside, and we have now moved to working towards zero waste discharge into our rivers. The two traditional rivers that fall into the ABD area, which is the area-based development of Indore Smart City, has been the Kan and the Saraswati rivers. And we have had an overriding focus on undertaking an interlinked approach where we envisage the regeneration and regrowth of our rivers through the overall site development of the bank. As you can see, these are some of the old photographs of what the erstwhile Indore used to look like, and the kind of greenery and the kind of settlements it had around. Next, we can go to the next slide. This is the drainage system of Indore. As you can see in the circled bit is the area that we have primarily focused on. It is the intersection of the two rivers that I mentioned earlier, the Saraswati River and the Kan River. We undertook development of this as we thought that primarily focusing on this area would help us in pushing back our overall development plan to other areas as well. So we started with the point of intersection of these rivers, and we have worked towards an overall riverfront uplift of this area. And I'm happy to say that today we have zero waste discharge into these rivers. We have worked towards zero waste discharge into the rivers of entire Indore. And we have also managed to now provide clean drinking water across these settlements. We can move to the next slide. The overall riverfront development of Indore has focused on how we look at this stretch of the Saraswati Kan River. The entire stretch has been broken up into 8 segments. The way we look at it is that each of these 8 segments has a different story to tell. Each of these 8 segments has a different economic and commercial as well as social outlook. And we have tried to redevelop this area not only with the viewpoint of having clean rivers, but at the same time of redeveloping the neighboring areas in order that the sustainability of the river course is established. Next slide. Indore Smart City has basically undertaken what is called an area-based approach for tackling the problem of pollution of the rivers and dying of our existing water sources. And we have tried to focus on uplifting these particular areas by linking them to the existence of the river. Next slide, please. As you can see, the approach and methodology has been quite focused in trying to understand how we can do a holistic development of this area. We have tried to look at the whole perspective of riverfront upliftment through the perspective of the 3 broad segments, which is the first is the environmental issue. Obviously, the infusion of life back into the river requires us to tackle some deep-rooted environmental problems. We have also looked at the transportation network. The development of a conjugated traffic movement plan has been the idea behind development of these riverfronts. And the third has been the kickstarting of the socio-economic and cultural activity that we envisage can evolve around these riverfronts in order that we may be able to sustain the life of these rivers. I would like to just give an insight around the course of these rivers. The intersection between the Saraswati and the Kan River it happens around the most congested part of Indore. This is the most populous part of Indore, and the area is entirely chock-a-block with busy streets, with commercial activity, with existing markets, and old heritage. It is interesting how we have managed to link all of our smart city projects around the development of this river. So I can proudly say that our riverfront development is not just about the river, not just about providing a clean and clear riverside to the people, but also about provision of existing water and drainage pipelines, of providing heritage reconstruction activity around, because this area is surrounded by rich cultural heritage monuments. We've also worked on roadside development. We've tried to put in as many multi-level car parkings as we can, as this area is primarily looking to be developed as a no vehicle zone. So the approach that we have had towards riverfront development has been primarily local in its need, as well as very specific in its outlook. Next slide, please. As I mentioned earlier, some of the issues, as you can see, these are some of the photographs of how the riverfront looked before, and some of the patches of the work that we had undertaken. There was, because of encroachment and slums, there was a seasonal flooding in this area, and the contamination of groundwater was a leading cause of unhealthy living, because the riverbed had been encroached upon, and there was a vast degradation of open green areas. All of this led to huge environmental challenges when we took this up. Next slide, please. Another issue, as I mentioned earlier, was around the congestion. As I mentioned earlier, the area is the most heavily densely populated part of Indore, and it was not just a regular commercial activity that was seen around this area, but also disaggregated living conditions, huge congestion of unauthorized parkings, and unmanageable traffic. The problem that we had, next slide please, the problem that we majorly focused on was the socio-cultural and economic aspect of this. As you can see, we had huge unmanaged parking at public places. In fact, when I remember in one of our projects, we had gone to undertake a heritage conservation work at one of the monuments, and we found, as you can see in one of the photographs, we found parking inside the heritage monument. This speaks often about the degradation that we allow with our natural and cultural heritage works that we have in our cities. And this is often the reason why these monuments of natural and cultural importance are hugely neglected. Next slide, please. Some of the opportunities that I just wanted to highlight briefly was that we had often envisioned that our riverside and riverfront work would involve cleaning up of the river and treatment of the wastewater and diversion of sewerage through the proper networks. But we realized that it was not just that, it was a gamut of opportunities that Smart City was presented with, and we were happy to take them forward. We ensured that we had integrated and planned movement of traffic. We had, as I mentioned before, we had interlinking of various projects around the riverfront development. We undertook heritage conservation projects. We undertook road development projects. And at the same time, I think we realized that decongesting or restoring our natural river heritage is very closely linked to improvement and upliftment of the living conditions of the people. Next slide, please. As I mentioned before, some of the challenges I have mentioned here. Sewerage outfall into the river has been a huge challenge for many cities. And this is one of the reasons which leads to contamination and poor living conditions. I'm happy to note that now Indore is moving towards 100% stoppage and zero outfall of sewerage into our rivers. So that is one achievement that we have managed to pocket. The other obviously has been that there has been a huge removal of encroachment, illegal encroachments and waste dumping along our riversides. This has reduced to reduction in the flooding in slum areas. Often we have noticed that when we undertake the riverfront activity, it is related to the development of the entire neighborhood, and neglect of provision of basic municipal services is also one of the reasons why we have neglected these areas as an overall development, and we have failed to incorporate them as part of our vision to develop the city. So we were happy that we were able to target these issues. Although they seem to be challenges, we were happy to have converted them into opportunities. Next slide, please. As I mentioned before, the riverfront development was undertaken over 8 stretches. We have been able to complete some of them, and the total cost of the entire length of 3.2 kilometers has been approximately 60 crores. The biggest challenge, I think, next slide, please. The biggest challenge with undertaking the kind of riverfront development that we had envisaged was not just the natural and the cultural heritage, but also the relinking of the economy of the people. This particular slide talks about one stretch of development, which is the CP Shekhar Nagar. I remember when this redevelopment was undertaken, there was a huge activity of resettlement of people, because this stretch actually had 3 to 4 slums. All of those slums were shifted and moved to proper housing conditions, and this entire area was redeveloped as a open public space. Although, moving on to the next slide, please. Although this area had a huge problem of congestion, of traffic, of non-availability of open public space, we were happy to be able to have converted this into the kind of riverfront that you see in through these photographs. One of the biggest and the most challenging parts was development of the toe wall and the stone pitching and development of road. We noted that once the area was redeveloped, we were happy to see that traffic was also diverted from the inner part of the city, and the city traffic movement breathed a new life into the movement of people. Next slide, please. I'll just quickly run through some of these phases. This is what the riverfront looks like today. And as you can see, an STP is also coming up in the area. The water has been cleaned up, and the entire area has had a facelift and is now open to public use. The market that used to be conducted here continues, and I'm happy to note that people who earlier were to visit the market are now able to make use of the adjoining amenities that we've been able to provide. Next slide. This is, as I mentioned before, the existing slum. There were approximately 1,400 dwellings at the start. And this is the layout, the previous look when we started. This is what the riverfront actually looked like. As you can see, the riverbed had completely dried up. The entire area had been encroached upon. And there was a massive degradation in the living condition of the people here, which was also dependent on the condition of the natural resources in the area. Next slide. Next slide, please. I'll just quickly run through some of these photographs. This is what the riverfront development looked like. These were the existing conditions. The slums, and as I mentioned before, this is the traffic jam that used to happen because of the huge congestion. Please move on. The rehabilitation efforts that were undertaken was around providing the 1,400 families to move from the slum and squatter living conditions into a proper constructed housing. And the schemes that we depended upon were the Government of India schemes around housing, where they were resettled and removed. And public transport facility was also provided to the rehabilitated families. Next slide, please. This is the transformation, as you can see, from the earlier photographs in onto the present. Next slide. And this is exactly what it looks like even today. Next slide. Next slide. This is what it looks like during our famous monsoons. And these are some of the photographs as we move on of the various stretches that we have been working upon. As you can see, we've now had dedicated water pipeline and supply of drinking water to all the neighboring areas. Next slide, please. This is the redevelopment front of the riverside. Next slide. The parks and the open spaces have now been made accessible to all, and their all abilities accessible as well. So these are often used extensively by the local populace. Next slide. As we move forward, I'll just cover some of the other stretches that we have worked on briefly, as I realize that I'm running out of time. We'll quickly run through these photographs, and I'll give a background of the overall riverfront development. Let's move through all of the slides, please. Each of these stretches has had a different story to tell. Most of these stretches are under construction. Some of them have already been completed. As you can see on this particular stretch, we have undertaken extensive landscaping activity as well. A lot of work that has happened around riverfront and water conservation has been associated with our cleanliness drive, for which Indore as a city is quite well known. And I'm happy to note that we have had extensive support from the local population, and they have come forward and helped us. The same people who had been resettled have actually come back and started using these amenities that we have provided. Next slide, please. This is some of the media coverage that we had during the monsoons. Next slide. Next slide. These are the photographs of the riverfront stretch adjoining the previous one. So this is the stretch 2. And a lot of development and redevelopment has happened along these stretches. So I'm very happy to note that some of these stretches have actually transformed the look of the city for the long term. And some of the designs that we have incorporated have also had innovative solutions that, like for example, this stretch has the commercial as well as the public space neighboring each other. This has been an experiment that's been hugely successful in India and in Indore. And this has been associated with the redevelopment work that we've done with the river. Please go on. This is some of the resettlement of the commercial complex. The parking and the shops have been provided in order to undertake the commercial activity that was existing in this area. So we did not want to harm the economic activity that was going on. And we hoped that we could convert it into an ongoing commercial center. Next slide, please. Next slide. These are some of the areas that we have now developed, and I'll just keep you going through these photographs because, as they say, pictures can tell a story in lesser words. So I'd let the pictures speak for themselves. These are some of the photographs of the ongoing works along the riverfront that we are now underdoing with the design and detailed components of each stretch. And these are some of the site photographs. As you can see, the entire riverside is now undergoing a transformation slowly but surely. And the access to the area has improved with regard to all kinds of amenities and activities. At the end of this, I just wanted to add that our experience, Indore Smart Cities experience with the riverfront development has been unique in a manner that we have tried to link many activities together. We have tried to undertake different segments of people and link them to the existence of the river, and we have tried to ensure that they can coexist with the rivers that intersect Indore, and they can continue with life as they always did, in better living conditions, in better working conditions, and a whole comfortable environment. Thank you.
Thank you so much. This was really, really interesting. And I think it, as you mentioned, it's a great example of where multiple goals can be addressed through one project. And that's what I do think is truly unique about the smart city structure, is that you can do these multi-sectoral type of activities, which include improvements to clean water, to beautification of the riverfront, and to dealing with sewage all in one go. So thank you so much for sharing that. Let me stop sharing and introduce our next speaker. We have Kevin Nelson from USAID in the US. He is the Urban Governance Lead for the Governance and Financing Self Reliance Team within the Bureau of Development, Democracy and Innovation at USAID. We are pasting in his full bio in the chat so you can read more about him. I've asked him if he could please just speak to us shortly about the knowledge brief series that that office has developed and how it relates to the topic of the day. Kevin?
Great, thank you very much, Amanda. It's a pleasure to be with everyone this evening. As was mentioned, I'm the Urban Governance Lead in the Office of, or in the Governance and Financing Self Reliance Team, and previously I was the Urban Team Leader in the Office of Land and Urban. And I mention that only because over the last few years in the Office of Land and Urban, I've had the pleasure of working directly on the Building Healthy Cities project, and had the opportunity to go to Indore about 2 years ago to look at some of the great work that was happening there. And I want to mention that as a bridge from thinking about healthy communities, and specifically in the topic that we're talking about today, specifically about water and how that impacts the health of the city. So I just have a couple slides, and I just mean to just take a few minutes to talk, broadly about a water series that the U.S. Agency for International Development has developed to address this issue and connect the dots in a very comprehensive way about urban indicators, health indicators, and looking at water resources and how that can come together. So next slide, please. So just briefly, the Office of Water within USAID has developed a 10-part water and development series, in which this technical series looks at and creates a set of technical briefs that provide guidance on important topics for developing and implementing water and sanitation activities to support the U.S. Global Water Strategy. And the plan to implement that strategy. So these briefs draw upon the latest evidence and provide recommendations for activity design, implementation, and monitoring. Each brief has different areas of focus, and what I will talk about just very briefly today is a focus specifically about urban, in which across the 10 water briefs, 2 of them have a focus specifically on urbanization, and particularly with that, the whole idea of focusing specifically on urban and urbanization has been in sort of the DNA of the cross-sectoral collaboration that exists not only within the agency, and as I mentioned, through whether I was with the Office of Land and Urban or now focused on governance and urbanization there. It's incredibly important for us to think about the ways that that as we think about a comprehensive approach and a multi-sectoral approach to addressing the urban service delivery needs of municipalities, of local governments, that looking at water as one of those key components is part of the calculus of not only addressing the issues in which we just heard about in terms of Indore, but looking at those particular solutions. So next slide, please. So in particular, technical brief number 6 looks at urban water services. And there are 4 key points that I want to bring forth from that document. And I can put in the chat a link to this document, as well as the water series, broadly, which was indicated on the previous slide. So the four key things that come out of this discussion of the water brief are urban residents' access to drinking water from a variety of sources. So as we know, there are different ways to provide this critical service to urban residents, whether it's kiosks or pipes or other mechanisms. We have to understand that there's no one size fits all, and that solutions need to be particularly geared towards that, especially in an urban context and an urban setting. Second, focus on capacity and efficiency improvements first before we have to focus on that first before large infrastructure investments. So ideally, that comes down to looking at ways to create a solution that's appropriate for the context, and in particular, not creating these large systems that overwhelm the capacity of a local governance. And one really poignant example there is in the DRC. I participated in a co-design project for urban and peri-urban drinking water solutions. And with that, it was very interesting to see a variety of consultants that were part of that process and part of that that idea base to generate ideas that really understood what the key issues were in one particular secondary city or another area outside of some of the larger cities that they had. And then that was useful. So third, ensuring targeted investments that serve the poor and the vulnerable. So again, this relates to the appropriateness of the investments and the solutions, and thinking about the financing of that, and knowing that if there's resources that are available or the generation of resources that are available, it has to be commensurate not only with the need, but also serving so that there's not an inequality, so that the poor and vulnerable are not not serviced because of the lack of resources that they have. And finally, the technical brief focuses on investing in governance, institutional, and financial arrangements. So it's not just about the delivery system, but it's about the ways that governance and the institutional bodies that work towards producing those results, as well as creating the mechanisms for financing. Those things have to work in concert. And many of the solutions that we see at AID take that comprehensive approach to bring forth solutions at the governance, at the institutional, and the financial level to bring those solutions together. So like I said, I'll put those things in the chat for both the Urban Watersheds technical brief number 6, as well as the whole series. But I think this is really useful for us to kind of have a bigger picture frame of the types of things that we want to get out of this discussion. So thank you, and I look forward to the continued conversation. Back to you, Amanda.
Thank you, Kevin. Thank you. That was a nice snapshot of some of the resources available for other cities in this area. I'm going to introduce our next speaker, Dr. Suresh Rohilla. He is going to give us a snapshot of some of the other pilots going on across India and other cities. And again, we'll paste his full bio in the chat, but just as a brief, he is Senior Director of the Center for Science and Environment, as well as Academic Director for the School of Water and Waste in New Delhi. And he's been working in this area for 24 years. So I'm sure he's got some great examples for us. Over to you, Dr. Rohilla.
Thank you, Amanda, for introducing. And I would need permission to share screen. Is it visible? Oh.
Yes.
Thanks, Amanda, for introducing. I would take 10 minutes, and if I would request that if you can stop me or indicate me 1 or 2 minutes before. I would be today sharing the experience and learnings of Center for Science and Environment. I lead the water program, and we have recently been involved in, we have been working over more than 3 decades, have identified few issues of urban water resilience and how it connects with improved, health issues, which today are very important. And trying to say that the green spaces or landscapes being created are not just landscapes, but they are basically, they can play an important role in improvement of water supplies. They can play a role as environment services. So I think these are the broad threads which I would say, and during the new normal in COVID, people are realizing the values of open spaces, that they should not just be just parks, but if they could be multi-use spaces. And there are some examples which I will present, but I will also present an overview picture to show that where India is, because I am also head of the Center for Excellence for Ministry of Housing and Urban Affairs, where we also give them advice on the reform agenda. And if we see that India today has 8,000 urban centers, and we see that there has been an extensively, increase in population. Increased population is resulting in increase in change in built-up area. It comes in different shapes and sizes, in the form of roads, in the form of landscaping, which is also largely built, paved surfaces and parking, and paved surfaces and footpaths. In the name of development, what happens? What results due to this urban built form increase is that there is change in the runoff, which is the pace of the water, the velocity increases. And the water which used to reach in 2 hours or 3 hours to the river, it actually reaches in 20 minutes. So that results in increasingly, various combination. And this has been, the study has been done across 72 cities. And we have also historically mapped that what has gone wrong, how historically we used to manage water, and how do we manage water today, which is more like institutions and utilities responsible with no role of communities. What has resulted today is that we see 2 pictures emerging, that there is a scenario where parts of cities or many cities are struggling to meet the water supply demand gap. There is huge exploitation of groundwater in the name of development. 40% of India is falling under the dark zone. That is the emerging water scenario. And these are assessments by Groundwater Board, which is the government agency. And on the other side, we see that there is a huge increase in the number of areas getting flooded, hotspots. Every big city, you name it, and we are having it, Pune, Chennai, Gurgaon, Hyderabad this year. So every year this is increasing. And people just pass away this saying that, oh, this was one of those highest rainfall year. But however, are cities ready to adapt? That is the big question. And are we going, what model will follow? We have done a quick research of the urban centers across the country, and we find that, in last 5 years, increased urban flooding incidences. You would see the major urban centers in India, more than 50% of cities have reported flooding, which is one of the major issues. And if we look at the status of groundwater, which actually means all the plans normally in the cities are made for bringing water from far away. However, when the demand supply gap is there, the cities are extracting groundwater to meet the demand supply gap. Individuals are having coping strategies. They meet their unmet demand from municipal sources by extracting groundwater. So these are some scenarios, and CSC has been working in this area, and we have found that the role of community has been totally destroyed in the water management in cities. They have been reduced to just a subscriber. And India's rich hydrological traditions have been lost into the mindset of flush and forget. On the one side, we have a paradigm where we want to bring water from far away. We neglect the local resources like ponds, lakes, water bodies. We only talk about end of the pipe solutions like sewage treatment plants at the end, but we don't talk about decentralized solutions where also, and what happens is many times the centralized sewage treatment plants normally, after spending crores of rupees, they end up disposing of the treated water back into the river, which is basically of no use because half of the city is not covered by sewer network and there is a sewage flowing into that. Then it is back to square one, that you have spent crores of rupees, but you have mixed the treated water with the untreated sewage which is flowing. Today, the biggest problem is that I may be corrected that maybe there is one or two small case examples of 24/7 water supply, but out of these 8,000 urban centers, there is hardly any city which can say that they have 24/7 water supply. And only today in India, 30% of the sewage gets treated. And of this total capacity, 50% of the capacity of sewage treatment exists only in Delhi and Mumbai. If you look at this kind of a difference and the change stage which is required, CSC strongly feels that there is a challenge of innovative policy and practice and the scale at which things have to change. Certainly, there are interesting projects which like smart cities, Amrut, and all those things, but it caters to only 500 numbers out of the 8,000 urban centers in the country. So across country, there is a big requirement for change. There is a natural catchment which is extensively undergoing change with huge, programs like affordable housing and this infrastructure or that infrastructure project. There is hydrological impact of this urbanization, and there is a need for relooking at this. What happens is basically that we are trying to promote that, instead of uh, first neglecting the local resources and then bringing water from outside, we should have possibilities explored within cities, how we can delay the monsoon runoff, we can store as much as possible wherever possible within the city, and then only if we have explored all the opportunities, then only we let the runoff go into the drain or to the river. This is the new model what we are trying to say, that such that we can address both the issues of water management as well as uh, I would say water mismanagement as well as the flooding issue. So this is the paradigm in which we have been trying to push for changes, and we strongly believe that this can only happen if we change the current paradigm where we think that the centralized systems will be able to provide all the service delivery context. Unfortunately, what happens is even in the big cities like Delhi and Mumbai, 25 to 30% population or as high as 50% population lives in unplanned areas. And they remain outside the purview of service levels or the targets which are there, which are high targets. And what we feel that, do we need to follow the same paradigm that developed world has followed, that, first we become a water supply city, then we become a sewer city, then we become a drain city, and then we have lost all the opportunities. We have built all the open areas or, catchment, lakes and water bodies, and then we start talking about a water sensitive city, because many of our cities in India are actually, they still have opportunity or they are still growing. So they need to be more water sensitive. I think that's what is the current paradigm which CSC is pushing for. And we have explored that the master plans of around 60, 70 cities in India. And we have found that without changing the building norm standards within the existing planning standards and norms, there is open spaces as high as 74 to 79%, which is available for innovative practice and innovative policy. These pie charts show you the extent of open spaces available in small medium towns as well as metropolis cities. You would see that within the residential neighborhood there are extensive spaces, but however they are neglected. But there is focus only on the centralized forces of bringing water or making centralized sewage treatment plants. We have developed some solutions, and these solutions are basically two case studies I will present here. One from Odisha, Bhubaneswar, which is also a smart city, and Delhi, which is also basically which is also one of the smart cities. And we have suggested to the government saying that there could be some additional possibilities of exploring intervention areas. If we look at in Bhubaneswar, we have identified few parks, and we have been able to tell to the Housing and Urban Development Department that there is an extensive potential of utilizing the existing spaces being planned as per the master plan. There are playgrounds, stadiums, sport complexes, parks, and garden areas, and multi-purpose open spaces. These are the terms which every planner uses in the area development, that these spaces are available which could be utilized for harvesting the stormwater. And if we look at these numbers in Bhubaneswar, there are three parks like Indira Gandhi Park, Biju Patnaik Park, and Neighborhood Park. The area is given here in square meters. We have given the scale at which the intervention can be made. It could be done at a city level as well as a neighborhood level. And there are several structures we have said that these are structures which are not with cement and brick, but they are structures which will retain the flow runoff in the form of swales, bioretention area, detention areas, which will also engage the communities, and they will also increase the aesthetic value, improve the living condition, which will add value to the health, public health requirements of today. And we find that the rainwater harvesting structures or stormwater harvesting structures in these parks will use only 1 to 3% of the total area. However, you could harness 43 million liters water in these three parks itself. Assuming that we have 15 neighborhood parks, a total of 59 million liters of water can be harvested annually. You can imagine that how much reduction in the flooding events would happen with this much water not going to the roads and becoming the hotspots, as well as contributing to the total water augmentation in a city. So this is one case. And now I'll move on to, we have done for Cuttack as well as we have done for other cities in Rourkela also. These kind of detailed area development studies have been done. And now I would come to Delhi. Recently, a report was submitted to NGT that there are 16,000 parks and open spaces in Delhi, which have 8,000 hectares under it. And Delhi is one of the national capital and smart city, and there is potential of 12,800 million liters of rainwater which could be harvested in Delhi annually. However, it goes down to the roads and creates flooding hotspots. So what we see that we have done detailed mapping of these parks within South Delhi, North Delhi, and East Delhi, and we have examined basically three parks similar to what we did in Bhubaneswar. Saket District Park in South Delhi, park along the Ring Road where there is flooding which happens, and neighborhood park around Greater Clash. These are very highly built up areas which has a mix of planned and unplanned both type of developments. And we have found that there could be these 1 to 2% of the total areas, or maximum 3% of the area which is utilized in these three parks. And you could actually harvest 12,800 million liters of water annually. And you could address both all these issues of flooding as well as water management. And you could improve upon the paradigm how water is managed. And there is a decentralized water management. And also you could engage with communities, and you could also add value to the healthy systems or public health issues, which is today important. We should not just look green areas or blue areas at as a landscape issue, but we should look at blue-green spaces as infrastructure. And we should make water everybody's business, which also Aditi ji talked about. Riverfront is also connecting to people. But we should try to see that how we can reduce the less built form, but we could create more natural spaces. We also enhance the water literacy. We also have a strict legislation followed by this. So for the government of India, we have developed two guidelines, basically water sensitive design and planning. These were supported by government, and they are mainstreaming this. And Odisha government is the first state government to issue guidelines on mainstreaming water sensitive design and planning and green infrastructure. I think with this, I would end my presentation, and thank you very much for giving me an opportunity.
Thank you. That was very interesting. And I like to hear both the breadth of urban spaces in India and some of the examples from other cities. So that was very, very interesting. Thank you. All right, so we're going to head into our last presenter, which is Dr. Anuradha Jain from the USAID Mission in Delhi. Anuradha has been with us through this whole webinar series, and she's been able to really provide some really keen insights from the mission side. She has 15 years of experience working in public health, and she's a clinician with formal training in public health. And she served on various prestigious national and international organizations, such as the National AIDS Control Organization, National Health Systems Resource Center, Save the Children, and INCLEN. And again, we will be including her full bio in the chat. Over to you, Anuradha.
Thanks so much, Amanda. As Amanda just mentioned, I would be discussing more around our future plans on something that we are intending to do in a few cities across the country. So as Kevin, I work for USAID, which is United States Agency for International Development. And we have had a history of working in the urban sector for almost 20 years. So very proudly, I can say that we are the pioneers and the leaders in the urban space for the last 20 years in the country. And a lot of success in urban health is attributed to the work that we have done in the past in the country. What we are envisaging to do for the future in this country is trying to look at development of something known as resilient cities. And the word resilience, as it is self-descriptive, means that, whether it is individuals, institutions, economies, systems, they need to survive, they need to adapt, and they need to grow when it is a chronic crisis situation, or if it is an acute crisis situation. So the system needs to evolve itself out of this situation, at three levels. One, at a level which is, self-responding, a level which needs mild efforts to resolve itself, and at a level where contextual changes to policy, governance, and things like that, and even including, funding is required for that matter to respond to a situation. So our when we start this work, we are trying to look at the preliminary level, which is the level 1 of responding, to a crisis situation. And what has happened in the past 9 months to a year in this country, where the cities have changed the challenge of COVID-19, and where people had to suddenly leave cities, especially the migrants and the vulnerable population, and return back to their own villages, not because of the fact that the cities were hostile to them, but because of the fact that they did not feel the sense of security. They did not feel, that sense of belonging to that place, and they were not able to respond to the acute crisis that they were facing at that point of time, and they did not see a ray of hope around those places. And this is not generalized across the cities. There were cities that distributed, ration. There were NGOs that came up and became the first responder. But what I'm trying to say is there was not a systematic effort, aligning things immediately and, in a systematic manner to respond to some of these issues that arose in the time of COVID-19. And it was a big lesson that we all have learned over a period of time. Cities have multiple challenges. It is health, it is water, it is sanitation, it is infrastructure, it is living, it is, name it, food. There are multiple challenges, and USAID as an organization, as a donor, can't solve all of them. But what we do, that we are a facilitator, we are a catalyst, and we try and leverage a lot of support from all different corners as much as possible to respond to a lot of these challenges that the urban population faces, especially the vulnerable. But as a starting point here, what we intend to do is with our own funds, and how we plan to do this resilient city model is by conceptualizing a design around urban universal health coverage, which is largely of composed of three components. One is governance, the other one is the social determinants for health, and the third one is to access to services. And while I am talking, I would like to add a disclaimer here that we are starting with the fact in mind that individual and communities are the center of what we are going to do. We are starting looking at the health system strengthening with some issues of governance and social determinants that have a direct impact on health. And as we evolve in this model, we would love to garner support from different corners to address certain different issues. But for now, the model is largely looking at health. And, what we are trying to do here is we have layers that address intersectoral planning and accountability. So there's an outer layer of social determinant governance and access to service. There's an inner layer of individual and community. And between these two layers, we have these different pieces that we will work upon. And the intersectoral planning and accountability is largely at the level of municipal level and not at the national level that we are talking about at this point of time. what is the other piece that is very important is collecting relevant data which is answering, or which is responding to some of the problems identified in a city, and then triangulating that data to feed into decision making. So Ms. Garg just spoke about how the waterfronts had evolved and how they had taken certain decision based on how the areas were so densely populated. There were market, there were commercial places, but still they were able to do this work. So they must have, I'm very sure that they must have taken certain set of data which was identifying this problem, which was finger pointing at some of the issues that needed immediate resolutions. In a similar way, we are going to pick up problems, collect data around it, triangulate that data, and what BHC is doing in terms of doing system designing, we will utilize that kind of capabilities within our partners and do some kind of designing and look at things which can help us then form that public health system or the private system, contributing to it, which can then help the public health system to become more responsive, more accountable, and the communities becoming more, demanding in terms of those services, and have actual enablers present with them, which can help them reach those services. So we will, you will help develop that ecosystem through our set of partners, which will which will help the communities get those paperwork done, those cards and those amenities and those entitlement seeking behavior that they don't have till now because they don't have that paperwork with them. So they will seek their entitlements, they will demand for services, and they will also feel themselves accountable contributing to those services. So the idea behind this, the NSSO shows that health is fifth in the priority of any human being or any individual living in a slum or a vulnerable situation. So how do you solve the first 4 tier of problem for that individual, whether it is a ration card for food, whether it is the issue of water, whether it is an issue of paying the rents. So how do you help people connect to those entitlements that government has provided, and how do people get some free mind to think about their health, and then they start thinking about their health and well-being. So those connections as a part of resilience mechanism have to be established. And last but not the least, the use of artificial intelligence based solution to help people reach to some of their entitlements would be definitely worked around. So technology will not become the only answer, but technology will definitely become an integral part of what we are talking about here. And other enablers that we are also trying to look at is in terms of the determinants, as Dr. Rohilla talked about, flooding in cities, the issue of sanitation, and people not having drinking water availability, and the use of water harvesting and the rainwater in a city. So how do you actually involve some of these areas which are affecting health directly and resolve some of those issues along with the improved governance to answer some of the unanswered questions in terms of health and well-being. And last but not the least, using some non-traditional indices of measuring growth, well-being, and demonstrating model for family well-being. So overall, it's a model that looks at individual and community with these different layers of triangulation of data, entitlements, governance, and social determinants. This is a multi-partner approach. So we are going to have multi-partners in city doing this work, because it is not in capacity of one partner to do it. And it will definitely look at a system which is more integral in nature. It will look at a system which is not looking at an individual and a family as separate from infrastructure, as separate from a smart city, as separate from the issues of sanitation and water. So keeping that family and its well-being in the center of it, the whole health and wellness concept would be tried out. So that's our idea for the first layer of the resilient cities. And once we are successful in the layer 1, we will try and look at layer 2 and layer 3, which will be an evolving concept. So that's a very preliminary concept of a resilient cities that we have thought through. And as we go on in the cities, we would be, welcoming experts to come and support us, help us, seeking support from the governance experts and administrators like Ms. Garg, who's here in this webinar today. So that's it for now from my end. And over to you, Amanda, for any further questions. Thank you.
Great, thank you. Thank you. Very interesting, and I'm sure we'll have questions on that. So now we're going to transition to our question and answer session. Thank you for those sending in questions on the chat. The first question is going to be for Ms. Garg. And this is coming from me as moderator. I get first choice in questions. So what you presented around the waterfront is very innovative. And I know you've also done some other work that's sort of on the innovative edge around the biomethanation plants and the solar plants. I'm curious if you could speak a little bit about if and how the private sector is involved, either through funding or through partnership on these, and how you would see the private sector being involved in the future on some of these water-related projects or climate change generally sort of related projects.
So Amanda, I'm very glad that this question was raised, because you see the smart cities mission as it is designed in India, as well as the overall urban understanding, is that public and private partnership should be to the extent of 60% of the projects that we undertake, which goes to show that our redevelopment works, our urban infrastructure civil works are not in primarily the purview of the government. We are looking for public as well as private participation around these. And I'm happy to note that in Indore, at least, we have been able to involve the private sector in many key turnkey projects. So to give you an example, the riverfront development that I was highlighting here earlier has been threefold. First has been along the actual river itself, the bringing back the river to life. And we have had massive public participation in our Swachhata cleanliness drives, in our overall assessment of the river situation, and in ensuring that we are able to clean up the river from the source till the base. So I'm happy to note that we have had participation extensively on the first aspect, voluntarily, as well as through our formal procedures. The second has been the participation around civil infrastructure. So through the process of public-private participation, as well as through the process of government procurement, we have been able to ensure that we have built capabilities of the private sector who can deliver in this space. I would like to share another example here. We have had the benefit of experience now, and some of the key startups and entrepreneurs in Indore have been around the projects that the smart city runs. So it's a very coexistive ecosystem here, where the private sector not only helps the government, but it also feeds it with new ideas, new rigor, and new streams of technology. So that's my second thing. And I think the third most important thing is with organizational participation. So by that, I mean through various organizations and agencies that have helped us, provided us with aid, as well as provided us with insights on some of our areas. One of the suggestions that has also come right in the panel has been around providing of clean drinking water through use of technology, through use of minor interventions. And a lot of that has come on the back of our international partnerships. Some of the work that we have done around Indore has been focused on bringing about social, societal, as well as individual change through the help of these organizations who have expertise in these areas. Because the government, although I mean, operates along the length and breadth of these sectors, we do not claim to have the expertise in all. So we've been very fortunate and happy to have private participation.
Great, thank you. The next question is for Dr. Rohilla. So this is, they're saying that you have been a part of this area of work for quite a while, and you've been on multiple global platforms. Where do you think Indian cities stand in terms of addressing this sector? I'm guessing sort of if you're comparing it to other countries' cities. And what do you think, if you can name one mechanism or solution that is most likely to be adapted for the Indian context? Could you share that? You're still on mute.
Yeah, I would like to share experiences from Australia. Recently, we have been working closely with them, and we have tried to see that it's not that India was always not managing its water resources or areas properly. Only in the last 5-6 decades that area development has gone more towards concretization and ignoring the possibilities of in situ water augmentation. Australia had 13 years of long drought, and then it started rethinking and realizing the value of these blue-green spaces, which could be also multiple purpose spaces that they could be used for recharge areas, all those. So do we have to wait for a drought to happen to tell us, or do we have to wait for so do we go full cycle that way, that or we prepare for we start preparing for us, because we don't have that many resources, or we don't even have colonies like we were a colony, and we are not that resource rich, that now we have to develop sustainable and affordable model. We do see that there are incidences of few cities being addressed by a few project approach. However, the challenge lies in that including the spaces within these cities, as well as in the other cities who have nothing on the ground. They're in front of them is the open slate. Whatever you want to write, you can plan. Do you wait for those 7,500 urban centers in India to go all the way, first pipelines for water, then sewer network, and then you mess up with your cities, and area development is gone for a sixth, and then you talk about high cost redevelopment. I would say global knowledge is enough. It's not just that. There is enough evidence now saying that decentralized approach is the way forward for enhancing the value of these interventions. And we need to leapfrog, I would say. Australia is one example, and I said, do we have to wait till like the Cape Town situation, which we saw in Chennai, that city was going dry? Do we wait till Hyderabad city going down with water? Do we wait for Mumbai every year to go down with water? All the cities have a same area development approaches in India. So, but however, there is enough evidence. If you look at US WERF, which is the most scientific body, has enough evidence that decentralized water management practices is the way forward, and things have gone very wrong in the past. It's a high cost solution of centralized water and sanitation system, which even the developed world is not able to afford to run these systems. So Global South has to look for leapfrogging and innovation in policy and practice if it has to bring change at a country level. That I would say, with my global experience, I think that's what I see.
Thank you. Thank you for that. Dr. Jain, what would you say the timeline is for the new project that you were describing coming out of the mission?
So Amanda, this is slightly procurement sensitive, but what we can reveal to you is that we will take, and we were in process of discussions with the highest policy makers of the country, and we have a green signal from them to move ahead in the process. So as a result, we are in the phase of finalizing certain partners who would be working in this area. We have existing partners in those cities, but we have, since this is a multi-partner approach, as I said, and one partner doesn't have capacities to do some of this work, because this is beyond health that we are talking about. So within a month's time, if we are able to work on our partners and get them on board, so we are assuming that by the end of February, we'll be able to kickstart this program.
Great, thank you. All right, we have another question for Ms. Garg. They say, from the beginnings of human history, cities have arisen from riverbanks. This is also the case in India's unplanned settlements. Yet our riverfront projects have been primarily focused on gentrification and decongestion. I was curious what kinds of community consultation and engagement were undertaken with slum dwellers. Was in situ rehabilitation considered? And how far are the resettlement sites from the riverfront? And I know you touched upon citizen consultation, and it's been a big part of the smart cities, but if you could answer their queries on this.
So I would like to get in my implementers, point of view into this rather sensitive debate that is going on again. Among the academia in India. There is often the whole concept of in situ settlement, and I'd like to touch upon this before I go to the citizen engagement angle. So in situ resettlement in India is successful in areas which are linked to economic activity and which have on-site provision of basic facilities. Because of the way India and India's cities have developed, this is perhaps not possible everywhere. And assuming that it would be made available is perhaps one of the fallacies that urban implementers have fallen for in the past. So with regard to our riverfront development, we try to club and synergize the efforts of multiple schemes, multiple efforts of the government, one of which, as I mentioned before, is around housing and provision of basic services. So I wanted to ensure that the resettlement of the people was not away from their daily economic activity, but at the same time, there was provision of basic services, basic amenities, basic facilities that would uplift their living conditions. And when we clubbed our housing scheme with our redevelopment scheme, we found this to be a very easy mix, which is why I also mentioned that when we resettled people from around the riverfront areas to a certain housing residential areas, we also provided them with the transport facilities, and this was a big boost to our urban transport and public transport especially. So in situ rehabilitation has to be looked at through the lens of not a utopian concept that we can work towards keeping all our present demands aside until we figure out the golden solution, but it has to be looked at through the lens of what people demand today. I would now like to come upon the citizen engagement that we had undertaken, and I'm also wanting to share here the part that we are actually going through the resettlement of another stretch as we speak today. And this is around 300 families that are being relocated from their present condition just next to the riverbed, and they are being relocated to another housing location. And our sense has been that people have actually come forward and demanded that they be moved instead of being left in squalor with bare minimum amenities, with no land rights and no ownership over their living conditions. So people have come forward and they have accepted that overall redevelopment of an area does not mean uprooting people. It obviously means resettling people. The whole concept of resettling is that even if you have to move some people around, you can still bring them back to their cozy comfort zone of having close amenities, of having their economic activities linked, as well as providing them with a source of employment and income. So we've been able to do that because uh, such efforts, they cannot be done in a hand-handed manner. The government, much as people want to believe, can get away with resettling people, moving them around. That is actually not the case at the ground level. It is purely through 100% participation and agreement of the people that we have been able to move huge numbers of people out of these poorly built living conditions into the areas that they now live in. And we've been able to enhance the usage of this particular piece of our heritage for posterity. So we've had an experience which I consider not very unique, because other cities which are experimenting with these efforts are finding that people are willing, they do want to and have access to better living conditions.
Great, thank you for that. We're going to say goodbye to Kevin. He's got another meeting he's got to run to, but thank you so much, Kevin, for your inputs, and this is very, very useful.
Thank you very much, Amanda. I appreciate the opportunity to speak with everyone, and have a great evening, and keep up the great urban water work. Appreciate it.
Great. And we're coming up near the end of our webinar, but we have one common question for all of the panelists. So I was going to give everyone a chance to answer this as we sort of wind this down. Since we are talking about emerging challenges to be addressed in an integrated approach, what are your views on existing professional capabilities within our public and private agencies to be involved in these urban transformations? And do you think that we are preparing professionals through schooling who are ready to work on these challenges? So why don't we start with Ms. Garg, if you don't mind going again with a quick comment on that, and then we can go to Dr. Rohilla and then Anuradha.
So Amanda, I can only speak for Indore as of now, but I do know that we lack key capability in terms of envisioning the future, preparing for it, and delivering it into the present. So there is tremendous scope for us to invest in our resources, to upskill them, to train them to prepare for the future, and at the same time for us to plan our policies and our schemes in such a way that they become relevant on the ground. A lot of times there is a gap in understanding between what implementers actually do and what policymakers actually envision. So I think there has to be a bridging of the resource gap as well as a capability gap from both ends of the spectrum. So for me, it's not just the upskilling of the implementers, of the urban practitioners, but at the same time, it is also the ground level understanding of situations, of policymakers, of advisors, and of our planners. So that's where I think our huge amount of resources need to be invested in.
Thank you. Dr. Rohilla?
I would like to say that, CSC attaches a lot of importance to basically capacity building and advocacy. Whatever we say may not see the light of the day, or it may not be translated onto the ground. That's why you would say that I have a dual role. I am head of a research advocacy group. I am also having a school of water and waste, which largely is supporting government. And we are one of the identified agency by government to support smart cities, Amrut program, Swachh Bharat mission, where we are building capacity, not just restricted to what Aditi ji was saying, that, to just policymaker or technical people. We are going to the last end, like plumbers and masons also. If we really want some change to happen, if we really think that policies can be made with good advocacy and all those things, however, how do you translate it to on the ground? So we strongly believe that if we really want to change at a scale, we also need a community of practice at different tiers. And if we have all those tiers, then only the change will happen on the ground. Otherwise, it's impossible. So that's why CSC has built-in processes, built-in resources. We have partnered to bring in on information saying that what we say is not something that which is taking you to a bullock cart age. What we are trying to promote in the name of being environmental friendly or water sensitive or water prudent is basically, if can we explore possibility of hybrid approach. It is smart and sensitive and affordable also. I think that's what we are strongly believing in. I believe starting from a bureaucrat to training a plumber and mason, we do attach an importance to that. Thank you very much.
Thank you. Anuradha?
I would second what Ms. Garg told just now, and I think there are beyond what she said. There are two more gaps that we see. One is that the skilling is seen as as something which only huge institutions and big colleges and big organizations can provide, whereas skilling is not that. Skilling, NSDS is a great example, the National Skill Development Council. It is giving a lot of good courses in this country, which people are doing. But one, linking those courses of NSDC to opportunities in the country. The second is even identifying opportunities and skilling that is required by the youth. That bridge is still not there. So one, identification or sensitization of youth, what the opportunities are, where can they get skilled at, and then linking them to those jobs. These are the three pathways which have to be very clearly created. One organization can't do it. There has to be ground organizations that have to get into it and start doing some of this work. And as Dr. Rohilla said, there has to be a mid path between what is ideal and what is practical. And that pathway has to be designed and conceptualized and contextualized to the need of the day. And it has to, the curriculums have to rapidly change over a period of time.
Thank you. Thank you for that. With that, I'm going to hand it over to Ashima to close us out. But thank you all to all of our panelists.
Thank you very much. I think that was an amazing, amazing session. I completely enjoyed myself to understand about various, integration of different systems that has to be there, understanding what Indore has been doing. Dr. Rohilla, your examples of Bhubaneswar and Delhi, I think those are the things which can showcase us that really things are really possible. It's out there, and it's not that we are talking about something which is rocket science. It's only putting the things together, and it's possible. Anuradha, your insight about the project, I'm really looking forward to, and we'll need to get connected on that offline and discuss that further. And more than that, I think the last question, well, I will just say that it was put by me, and because I wanted the panel and wanted to know their views about, because being from an academic institute, it becomes really important for us to understand how the industry, how the different agencies at different locations feel that what are the changes that are required at an academic institute. And I think, Anuradha, what you pointed out, that we need to have our curriculums which have to be very, very dynamic and responsive enough to address all these changes across. And that's the whole thing, and why as academic institute we kind of get involved in all these kind of debates and discussions. Thank you, Amanda, for taking us through this evening, and it was great to have you anchor the whole thing, the whole discussion.
Lost you.
Thank you very much, everybody. Have a wonderful evening, wonderful day, wherever you're located. And we look forward, keep watching us. We are going to have more series on this healthy cities. This is just the third one. And we are expecting to have at least 3 or 4 more of these. And together, these are expected to then come out as a publication, which becomes a ready reckoner for people, for implementing agencies,
academicians, professionals to refer to whenever they want to tap into any thoughts about how to build health in their cities. Thank you. Thank you very much. With that,
thank you for
thank
inviting.
you. Thank you, sir.
Pleasure meeting
Bye,
all of you.
Amanda. Bye,
Yes.
Dr. Rohilla. See you, Amanda. Bye,
Yep.
Archana.
We should touch base separately offline. Yeah.
Absolutely. Absolutely.
Yes. Thank you. Great.
Bye, people.
Thank you very much.